name is Marion.
I'm Natalie.
I'm Cassie.
And our presentation is on, is there a connection between antidepressants and suicide? So a bit of an introduction into this topic. Suicide is a very prevalent issue within our society. In fact, in 2020, it was the 12th most common cause of death for adults in the US. We've seen these rates risen over the past 20 years as concern has grown over suicide. We also have seen that suicide not only affects adults, but also affects young people. It's been seen as the third most common cause of death for children and adolescents, looking at ages as low as 10 to 24. We've also seen that depression and suicide commonly co-occur. When looking at patients at risk for suicide, we often see depression within those patients. And so antidepressants have been used as a part of the treatment for patients who are at risk of suicide. However, in recent years, there's been an increased discussion over possible risks that antidepressants may pose to individuals who are suicidal or at risk for suicide. And this discussion has led to an introduction of black box warnings by the FDA on antidepressants, warning people of these supposed risks. A little refresher on antidepressants. I know we've talked about this in class. There are multiple types. Most of the studies that we looked at were looking into tricyclic antidepressants as well as SSRIs. You know, SSRIs are one of the most popular antidepressants in use today. We also know antidepressants are targeting those monoamines in the brain, those neurotransmitters that we study when we're looking at depression, like dopamine and serotonin. We also have seen that clinical effects can take a long time to be felt by the patient, up to weeks, which is something that is a concern when looking at patients who are suicidal or at risk. We've also seen suicide affects both children and adults, and antidepressants have been approved for use in both children and adults.
So there's also, we mentioned earlier black box warnings, and we talked about that in class as well. This is an example of a black box warning. It just notifies the people who may be using the drug that there is an increased risk of suicidal thoughts. And there was a requirement passed in 2004 from the FDA that made it so all antidepressants had to have a black box warning on them. And there are two kind of perspectives on this. One is that black box warnings scare people, so adults who may want to put their children on antidepressants or people who may want to go on antidepressants themselves are frightened by this, and that leads to them not taking the antidepressant, which eventually leads to increased likelihood of suicide compared to if they did accept treatment. The other perspective is sort of that because there is evidence and studies that support the idea that suicide risk is increased when on antidepressants, it's morally wrong to not include that warning regardless of how likely or common it is.
So a bit of a look into the literature that we have found on this topic. I looked at this long-term study out of Sweden looking at years 1995 to 2005. This study was observational, looked at death records and toxicology reports to examine this possible correlation between antidepressant use and suicide rates. Within this study, they found that suicides overall had decreased by 18.6%, but they also saw that individuals who used antidepressants and committed suicide increased by 46%. When looking overall at the statistics and the data that they found, through their data analysis, they saw that this reduction in suicide rates was best explained by increased use of antidepressants. We see that there was an increase in individuals on antidepressants who had committed suicide, but overall, the reduction was best explained by antidepressant use, and part of this confusing statistic could be explained by increased prescription rates of antidepressants over time, as they're looking within Sweden. And so they found that there was this negative correlation that was significant between antidepressant use and suicide rates.
The study that I examined also took place in Sweden, and in this study they examined around 19,000 toxicology reports and looked to see if there were antidepressants present, specifically toxicology reports of people who had committed suicide. And they found that people who had a record had been hospitalized for depression or mental illness and then later committed suicide were less likely to have antidepressants in their system, which then comes with the assumption that people that were hospitalized and did go on antidepressants did not commit suicide, which kind of leads to the conclusion that antidepressants decrease suicide rates. They also found that from 1992 to 2003, nationwide suicide decreased, and within that time, they also observed an increase in prescription of antidepressants. So this is another point that supports the negative correlation between suicide and antidepressant use.
The study I looked at was from the Veterans Health Administration, and they used a participant group of about 200,000 veterans who were diagnosed with depression and then later received 6 months of follow-up treatment. They found that the group that had the treatment of antidepressants, specifically SSRIs, had a lower suicide risk, and then the group that did not receive the treatment had a higher risk. Overall, the study found that SSRIs had a protective effect against all adult age groups. But they also did this study in children, which the study's evidence didn't suggest any positive correlation between the two. I also wanted to point out that, as we said before, time is a variable that we should take into consideration, because the closer you are to the start of your treatment, the higher your suicide risk is going to be, and then after about a month, it decreases. As we said before, there are some studies that have a positive correlation between antidepressant use and suicide risk, but the studies we analyzed had a negative effect. So further research should be done looking at the different effects of various types of antidepressants like SSRIs, tricyclics, low doses of esketamine, stuff like that, but also taking into consideration that time variable.
Here's a list of our citations. Are there any questions for us?